Welcome to the Real Life Diabetes Podcast. My name is Amber Kluwer, and I've lived with type 1 diabetes for almost 4 decades and enjoy sharing my story and those of other people living their best life with this disease. Today's guest, Nupur Lalvani, is the founder of the Blue Circle Diabetes Foundation in India, and that's just one of many things that she's got going on. I knew she would be the perfect guest, and she didn't disappoint. But before we dive in, I have a few quick announcements. Number 1, the Diabetes Daily Grind is a nonprofit organization. Funds raised help keep the website, podcast, and advocacy efforts afloat. It's easy. Just click the donate link on my website. Number 2, my affiliate and resources page feature reputable brands and services that make life with diabetes a more pleasant one. You can find all the deals at diabetesdailygrind.com. And finally, stay engaged. Love, like, share, and comment on all things social media. Sign up for the e-newsletter. Leave an iTunes review. Subscribe to my YouTube channel and click on the Amazon banner on the website before ordering. It doesn't cost you a thing and throws a little change my way. All right, let's get started. All right, Nupur, welcome to the Real Life Diabetes Podcast. I think, if my memory serves me correctly, you are my first podcast guest who resides. I'll let you tell everybody where you reside.
Wow, thank you so much, Amber. It's lovely to be here. Thank you for having me. And I'm Nupur and I'm from India. And I'm so excited to be talking to you today.
Yes. And there's so many questions. We're going to jump into this. And I start most episodes with, and I'm saying, everybody, I want to hear your diagnosis story because we're diagnosed with the same disease, but our stories can be very different. So tell me about what it was like, how old you were to be diagnosed with type 1.
Yeah. So I was 8 years old, and my family knew nothing about type 1 diabetes, not even that it existed. And I had all the classical symptoms. I had weight loss and, hunger and having to drink too much water, going to the washroom a lot. It was all there, and it was, it was just out there, but we didn't know. And then, lucky for me, but my father, kind of had a hunch, and my parents are not medical professionals, but my father still felt like maybe I could have diabetes. And where the thought occurred to him was when I'd go to the loo, there would be black ants in the loo, and it's an old wives' tale that says that the black ants are attracted to sugar. So my father put 2 and 2 together and said, I think my child has diabetes. And, that caused quite sort of a hullabaloo at home. And my mom wasn't happy with that. But we went and got tested. And unfortunately, the lab where we got tested, the guy said that her reports are normal and the kid is okay. There's no problem.
What? Did they take blood? I mean, what were they determining? They took blood and they still thought you were fine.
Yeah, they took blood and they still thought I was fine. And I'm grateful to my father for insisting, and he got really mad at them, and he said, I know there's a problem and there's something not right with my child, and I don't trust you anymore. And then we went to another lab. So they said, okay, we'll redo the test, and we'll check again. And then they sort of acknowledged that they made a mistake, they slipped up. And they used, so my parents they've preserved the reports from all of these years ago, and they've used like a whitener on the report to sort of scratch out, So it was crazy.
Wow.
And then, we went to another lab, and my blood sugars was 636. So, finally we knew something's wrong, and the guy at the lab,
go ahead.
Sorry. So the guy at the lab said, her sugars are extremely high. Like, this is absolutely not normal, and you must take her to a hospital right now. Like, if you take her home, I cannot guarantee she'll be okay. So, figure out your logistics, but you must go straight from the lab to the hospital. And I'm glad he said that, because, the regular thing to do would have been to go home, think about it, discuss maybe, because we don't really know what we're up against. So then my parents took me to the hospital, and that's how it all began.
Well, when you got to the hospital, I mean, that story is very similar to mine. And then I was 8 years old, and, they took my blood sugar because I had all the same symptoms. And they told my mom, literally, you have to drive her right now to the Children's Hospital in the city, or we're going to call an ambulance. You cannot go home, whatever. And so I'm glad that they shared that sense of urgency with you, because that is life saving. So you get to the hospital, you start learning about having type 1 diabetes. Did they immediately, how long did you stay in the hospital?
A couple of days. I think 5 days of. I mean, not over a week, definitely. So it was within a week, and the only one thought, and it's so funny because as a child, my perspective was so different to, maybe an adult diagnosis or to my parents. My parents were obviously shattered. The
Right.
first night we checked into the hospital and they said, we're going to give her insulin for the first time and let's hope her body doesn't reject it, or the regular stuff that they probably say, all the disclaimers and stuff. And my parents were really stressed. I mean,
Yeah.
they thought that what if my body doesn't accept it, or if there's a problem, or if there's an emergency. But obviously, insulin was what I needed, and I was absolutely okay. And I had no idea what was going on. I mean, I knew something's up, and I saw my parents crying for the first time, and that really kind of it startled me because I felt like, have I done something wrong? Is there
Right.
I didn't think that there's a something that is bothering them so much. So the next day my mom comes to me and she says, you know what, you have, and they used to call it juvenile diabetes back then,
Yeah.
right?
Yeah.
So she said, you know what, you have something called juvenile diabetes. And I said, okay, mom. And then she says, you know what that is? You have to take shots. You have to take insulin shots. And I said, okay, mom, no problem. And then she's like, no, no, you don't understand. You have to take insulin shots every day, like each time you eat. And I was cool. I mean, I was like, okay, I wasn't ever scared of needles per se, and I still like to show off that I'm strong and I don't
Right.
get scared. So it didn't matter to me, but I know it was my parents were shattered with the diagnosis initially. So that was a tough time. But for me as a kid, I think I was more than anything, I was bored. Spending a couple of days in a boring hospital with people that are sick and dying, and you're a kid, and my parents got me a bunch of like Nancy Drews and
Yeah.
novels to read, and they got me coloring books and stuff, but it was incredibly boring. And there's a thought that's kind of stuck in my head ever since, that if there's a kid in a hospital that's diagnosed, and I want to go dress up like a clown or something, and just kind of make it a little fun for
Less
them.
stress. I got to say, the hospital that I was diagnosed in, Oklahoma Children's Hospital,
Yeah.
I, as an adult, volunteered there and was a part of the kid, what do they call it? The present cart or whatever. So I would come by and give you presents and talk about life. And these kids did not all of them had type 1 diabetes. They were there for various reasons, but man, just like you said, and my parents brought up my roller skates. I was roller skating around the hospital floor
Wow.
because I needed to do something. I was there for almost 2 weeks. It was totally ridiculous. But so I get where when you say that, it's yeah, you're bored. I love that your parents gave you the books and all that. So I want to shift into, okay, so now you're 8 years old, you're giving insulin injections. Were you ever on an insulin pump?
Yes. So I've used the pump for about 6 years, 5.5 or 6 years. Um, so about 9 months ago, my pump gave me some trouble, and I was having issues with the insulin delivery. So I
Mhm.
switched back to MDI. But the last about 6 years, I've been using a pump, and I use the Medtronic 722, the really basic.
Yeah.
A sort of old pump. So in India, everything's out of pocket, and there's no kind of insurance or coverage. So like you have to pay for your own, everything from strips to insulin to pumps to CGM.
Well, and something about this too. Okay, so there's a number of questions I have with that. Okay, is Medtronic the only pump that's available to you in India, or do you have
Yes.
Omnipod or Tandem?
No, we don't actually. And I know there's a lot of people, from our community that are really very, very excited about trying the Omnipod or the Tandem, but they're just not available. Until very recently, Medtronic was the only company. Sometime last year, Ypsomed also kind of came into India with the pump, the Swiss company.
Yeah, okay. Let me ask you this. Do you have access to inhaled insulin?
No, but I'm glad you asked me this because I've actually tried it. So a
Yeah.
friend of mine, a friend of mine from the States was coming down, and he said, there's this really amazing thing that I want you to try, and it's just crazy, it's incredible, and you're gonna love it, and this and that, and so I think 2 or 3 years ago I tried Afreza, and it was fabulous, of course, but it isn't here yet.
Well, and it's so fascinating to me because I have friends in the UK and we're all in Australia and we're all talking about like what you have access to. And it's crazy to me. And we're going to get into cost here in a second. But okay, do you wear a CGM?
Yes, I wear the Libre. I actually wear the Libre Pro. This is another interesting aspect to CGM. So in India, we have three types of CGMs. One is the Medtronic Guardian Connect.
Mm-hmm.
That works sort of independent of the pumps. I mean, there are Medtronic sensors with the pumps. That's a different thing.
Yeah.
But then the Medtronic Guardian Connect, there's the Libre consumer version, and there's something called the Libre Pro, the professional version. Now, among the three of these, the Libre Pro is actually the cheapest. So a lot of us here actually use the Libre Pro. So it's typically supposed to be used only by professionals, healthcare professionals, to kind of slap it on to a patient and then, like do like a post-mortem 2 weeks later.
That's there's so many things I'm like blown away by all this. Okay, going back to the fact that you said you pay out of pocket, and I don't want to quote this because I don't know that I can read it. But you were in one of the articles that I read. It's mentioned that many developed countries provide accommodations for people with type 1 diabetes because we're classified as disabled. And I know that the diabetes world is like, Amber, don't say we're disabled, but we can be classified as disabled. Don't like that, but whatever. So we are all fighting insurance to be able to get our things paid for. And there are so many, crazy things we have to go through. So when you say out of pocket for everything, insulin, test strips, which that blows my mind, which I still have to pay out of pocket for that myself, I guess, now that I say that out loud. What does that look like for you financially every month?
We actually we have a pretty active Facebook community, and I'm sorry, I have this sort of annoying habit to kind of circle back,
Okay.
to the community. We actually ran a poll in our on our Facebook community, and 49% of the people said they spend about anywhere between 6,000 to 10,000 rupees. And if you give me a second, I'll quickly look up.
Yeah, what that is in US dollars.
Yeah.
Yeah, I'd be curious about that as well. And no matter how it boils down, that is, I'm sure, a lot of money for many people. I mean, the majority of people living with this disease.
Correct.
God.
So it's anywhere between $75 to $125, which is, I mean, I know that it's criminal, the prices for insulin in the States, but then also the average income in India is lower, and there's it's just
it's a totally different. Yeah. And we're going to get into the foundation here in a second. My other question for you when it comes to supplies, are they easily, can you just go to the pharmacy and get it? Do you need a prescription? Do they have access? How do you have access to everything?
Yeah. So, this is, I know this is going to probably blow your mind, but I can walk into a pharmacy and I can buy insulin over the counter. I know that's not the case in the States unless you buy, the regular insulin from Walmart for $25. But,
right.
I've seen that on a lot of forums, but here you can walk into a pharmacy and say, hey, I want my Novo Rapid, and they'll just give it to you. I think they should ask for a prescription, but I've never been asked for a prescription in years.
That's so crazy. Yeah, again, mind blown with that. But I'm glad that you can do that, because if you're in a crunch situation, you that can work. So besides being fascinated by what's going on in India and with the diabetes community, because I'm watching the numbers, and you guys are, it's insane how
Yeah.
rapidly people are being diagnosed. And I'm curious, and I don't think you can answer this, it's just a statement necessarily, but is that because we have better technologies and we're trying to get everyone tested because we know that there's a higher risk? Or, and maybe people were walking around with diabetes and they didn't know it forever. So is the increase in diagnosed cases because we're actually testing, you know?
Yeah.
Yeah. So, okay, that's neither here nor there. But, okay, so what I really want to focus on is you created, correct me if I'm wrong, the Blue Circle Diabetes Foundation. And it's among the largest patient-led communities for all diabetes. That's amazing. Like, how did you get this started? Let's talk about what sparked this and how you made it happen.
So about 8 years ago, I moved out of home, and home was Mumbai. And I sort of thought like it's a good idea to move out, live independently, work a job. I mean, I got a good opportunity in in another city, about 3 hours away. So I thought it was a happy balance. I know my parents were worried, when I said I want to move out and stay alone, not because of anything else, but because of the hypos and the stuff like that, like the everyday diabetes stuff.
Yeah.
And they said, how are you going to manage? And you want to live alone? And what if you get a hypo? And who's going to help you? And who's going to administer glucagon and all of that stuff? And I said, no, don't worry. I'll figure it out. I've got this. Yeah, you don't have to
Right.
worry at all. And then I moved out, and the first night in my apartment living alone, I was like, oh shit. I mean, like, how am I going to? I mean, what if what my mom said was right, and what if I get a hypo, and like, who am I going to, call, or what am I going to do? And then I mean, you figure it out, right? Like, it's not
Yeah.
too hard. And I'd keep beside the bed, I'd keep my fully charged mobile, and I'd keep
Yeah.
glucose and water and stuff. And I had my family on speed dial. So, touch wood, I've not had a problem, no severe hypos living alone. But so that is how I sort of moved out. And I was associated with smaller communities back home, and I kind of felt the void in terms of not having dire buddies to kind of talk to or meet with.
Yeah.
And I'm not terribly social. Actually, I'm not social at all. But I still felt like it would be nice to kind of for there to be some community or something that people I
Yeah.
could connect in case I want to ask something or share something. And so I used to, I kind of looked up this local hospital, and I just thought, okay, let me just, walk in, and I don't have a plan. I don't want to meet the doctor. I just want to hang out. I mean, I just want to see what's happening.
Yeah.
And so I used to hang out in the outpatient department of this one hospital, and they used to ask me like, "Okay, have you come here to meet a doctor? With who do you want to see?" And I said, "No, don't worry about me. I'm here to hang out." And I was kind of like, it was funny because they didn't know how to react to me. And the funny thing was that the load of patients was so high. I actually ended up helping them. I would like talk to families while they were waiting for the educator or the doctor to sort of see them. So I think they were actually happy that. I don't know. They probably thought, who's this crazy girl that keeps coming? But I mean, now that she's here, she's one of us. So
That's
that's how.
awesome.
Yeah.
That
So
is awesome. And it's like I got to say, in the States, like, you would have been escorted out by the police, especially if
oh
you
god.
if you were to show up every single day. They're like, who is this crazy person talking to our patients? But I think that's great. So you got to see firsthand I mean, I'm going to say the trauma, but the people, when you're in that situation, are stressed out. And so, yeah, I'm sure that you were really a beacon of light in that scenario. So what did you learn from that, and how did that circle around to being turned into a foundation?
So slowly I began to realize that, people, I mean, if they see a doctor or an educator or someone in a position of authority, it's more like, I have to listen to this person because, they
Yeah.
know what's good for me. But if they see someone they consider an equal, or someone they, think that, okay, this person is just like me, she has
Mhm.
diabetes too, and they just really open up, and they really share all of their fears and their,
Yeah.
so I want to give you this example. So there's this family, 2-year-old child. This was many years ago, maybe 6 or 7 years ago. A 2-year-old daughter that got diagnosed with T1, and the mom, she asked me, I'm really worried. Is my daughter going to get married? And I was
Oh.
like, wait,
Oh.
that's nuts. Like, you got to make sure she survives. I mean, you have to ensure she thrives with T1. And then so there's all of these socio-cultural sort of issues in this part of the world. I mean, I know they're looking out for their kid, but it's a bit crazy, right?
Well, okay, so that is something that is on my list of things I wanted to bring up because I have not met anyone that I know of that has been a part of an arranged marriage. And I don't, and I'm going to sound insanely ignorant, so please give me some grace with this, is in an arranged marriage, if you have type 1 diabetes, are you seen as less valuable?
Yes, you're literally seen as like so I speak from the experience of the community. My personal experience, I've not been through this. So when people are of marriageable age, often families sort of along with the extended family, they look for potential partners together.
Sure.
And I've not been ever sort of comfortable with this kind of setup. So I know I'm not cut out for this. So I never, went through all of this. So I don't have any personal experience there, but I've seen like an incredible amount of people go through the motions, and a lot of times people are rejected solely on the basis of being T1, which is nuts. But
Yeah.
it's really like you're like a defective piece. That's
Yeah.
that's the vibe I get from the friends I talk to. So
Does that go the same for men and women, or is it just T1 women?
Sorry. Yeah, it's the same for both, but
Okay.
I know that it's definitely harder for women in anywhere in the world, right? I mean,
Yeah.
but uh, but I think it's women do get the raw end of the deal here as well.
That is so, I mean, you already, I mean, having a diabetes diagnosis, no matter how old you are or where you live, is a tough one. But
Yeah.
to be seen as damaged goods and less valuable is just, oh man, that is tough.
It's
So
literally like you're not a person anymore. You're a thing.
you're a thing. So, and that's okay. So let's talk about everything that the Blue Circle Diabetes Foundation offers, because I know you've got an app, you're connecting people, and just tell me more about what all you're doing.
Yeah. So we, about 2 years ago, we thought, hey, let's make an app, because there are tons of diabetes apps on the store, but we hadn't really come across any app that was sort of a little more India specific, maybe, or something that's made by diabetics and for diabetics. So we got down to doing that, and now the Blue Circle Diabetes app has over 32 million blood sugar records that people have put in, and it's just growing, because people are finding it useful and they're using it, and we have a very sort of open system. We have a section on the app which says that if you have a new feature idea, tell us, help
Yeah.
us to improve the app for you. So that's about the app. Then there's another thing that we started called the Buddy Project Helpline, and
Love it. Yeah. I'm sorry, keep
yeah,
going.
yeah. It's basically a diabetes and mental health helpline. And the reason the helpline came into existence was, back in 2020 when COVID just started and there were lockdowns and it was basically like crazy everywhere. I received a phone call from an acquaintance, a T1 girl. This was at like 11 in the night, and she was sobbing and crying, and she was like out of breath. And it really freaked me out.
Yeah.
I mean, I later sort of looked it up, and probably, she was having a panic attack or something. And I'm not a mental health professional, but I was just, on the phone with her, and, I mean, should I come over to your place? What do you want me to do? Like,
Right.
she just wanted to kind of let it out and talk and vent. And so that's when we realized that the lockdown and COVID has really, there's been a huge negative impact on the mental health of, people with diabetes. And so that's where the idea came up that we need to have a helpline. We need to have a sort of a resource that people can tap into. And people call me, sometimes at three in the morning. I mean, hey, my son's having a severe hypo. What should I do? And it's okay. Like, maybe sometime I take the call, but what if I'm asleep?
Yeah.
I'm completely sort of very tired, and I don't see your call. Or what if my phone's on silent or it's switched off? And it's a lot of pressure for one person. So having this helpline, the helpline is on the app, by the way, so
Mm.
people can log into the app and look at the profile of all the buddies. And there are a bunch of buddies, about 8 or 9 buddies who speak about 7 or 8 different languages. So
That's
nobody,
great.
yeah. So no one should feel like, for lack of knowing English or any other language. I mean, we shouldn't reach out, or shouldn't ask for help. And we've done, I mean, last I checked, we've done over 60,000 minutes of, one-on-one counseling, all the buddies together. And I know people, I mean, sometimes they know it's a very small issue or something, little that's bothering them, but being able to talk to someone, someone who doesn't judge you and understands you because they're kind of going through the same thing. And it's also a free service. So, the concern about spending money isn't there. Especially because a lot of people or families may feel that mental health is not something I want to kind of, maybe spend money on, or
Yeah.
it's all hogwash. So I think this is a kind of an in between, like a bridge between, if we feel like someone's having trouble or something, we definitely kind of refer them, suggest that they go see a shrink
Yeah.
or a doctor. But basic stuff, and we've been trained by a team of psychiatrists and a team of endos. So that was and sort of like a nice add-on. So that's the helpline. And then we have something called Project Gaia. So in Project Gaia, we're talking about women and diabetes because there's really a very unique kind of set of problems. I mean, your blood sugars are all over the place with so many things, and then add to it, your period and your
Yeah.
sort of hormones, and it's just crazy. So we kind of we have workshops where we talk about everything under the sun, and sometimes we just chill, and it's just like, okay, let all the girls get together and just kind of meet and talk and that kind of thing.
Is that an in-person gathering?
We started in person recently in the last few months, but all through COVID it was online.
Right. I would love to attend that for so many reasons. And let me go back to with the helpline. And you said that you were trained by endocrinologists and people of the mental health profession. How did you approach them with that? I mean, it's a no-brainer that would be valuable to what you guys are doing. Was there any pushback, or were they like, yeah, we're here to train you guys and we'll do whatever it takes?
So the second option. So this is a pretty cool endo that I know, and I don't consult him. I don't see him as a patient, but he seems like a really supportive person, and he's associated with a pretty large hospital here in my city. And he's always been very sort of open and forthcoming about, like, hey, if there's something you think we can do, or if there's something
Yeah.
that we can collaborate on. In fact, they have these medical conferences annually, and they bring us in as so we organize a run for them. We do a little fun run kind of thing, and they call us as speakers and stuff. So we had a pretty good relationship with this one endo and his team. So when we asked, they were more than happy to help. And with the psychiatrists, I didn't really know anyone personally, so I literally, sent out a cold email, and I said, hey, listen, I know you don't know me, and I don't know you too, but I've kind of seen you on social media and on Twitter, and I think you're really cool, and can you please train us?
I love that. I'm a friendly stalker myself, and that's how I'm having this interview with you today. Is because I'm like, oh, I need to speak to that someone, and all I can do is reach out. So good on you for having the courage to do that. And so there are a couple other things I wanted. So you talked about the run. So I want to start with moving out of your parents' home in your mid to late 20s. Now you're in a different city. Were your parents helping to manage your diabetes when you lived at home, or were they like keeping an eye on things, or were you completely in control?
I would say they were keeping an eye on things a little bit, but I was mostly kind of independently managing it. I think I'm not sure like at what exact age that changed.
Yeah.
But when I was newly diagnosed, of course, I was completely under their care and stuff. I started self-injecting pretty quickly, but
yeah. But they
I
kept
think,
an eye on things.
yeah.
Well, okay. And so now with you living in a new city, and my mom worries about me all the time and she'll whatever. So do they call and check in on you or?
Yeah. So I was going to ask you, I know the Dexcom has the Clarity app and the follow feature and stuff. And do your parents like follow you?
No, God, no. They wouldn't know how to use it and I'd have to train them, which I don't have the patience for. But no, the only person that sees that data is my certified diabetes educator. And that's only recently because I went to a new one and she was like, let's look at your A1C is 5.7, which is great, but let's look at your Clarity. Yeah, it's the lowest it's ever been. I'm proud of that, I guess. But she was like, let's look at the Clarity. Let's look at the numbers and make sure that you're not having serious hypos. And so I was like, okay, here I go. Relinquish control. Let this person have access to my numbers. And she is incredible. We walked through the whole situation. So that's a great question. And thank you for asking me. And I'm not married and I'm not dating anyone right now. And I don't know that I would share my numbers. I mean, it's kind of like, right. Well, and I've been doing it for almost 40 years. Like, I feel like I've got it down.
Yeah.
Now I will say that if I go for a girls' weekend or whatever, and I'll tell them the code on my phone, and I said, if I ever act weird or if you found me passed out, here's my code, and just check my blood sugar. And if it's either too high or too low, call 911. I mean, it's just one of those. So anywho, I don't really share. So if you were married or in a relationship, would you share your numbers?
I feel quite like you. I don't feel the need to share. My parents, I know my parents are concerned. So, and by the way, so we don't have Dexcom here in India. So, through the Blue Circle Diabetes app, we created this follow feature, and I wear the Libre Pro, and sometimes with the transmitter. And I know my parents are interested. They don't want to kind of infringe on my whatever like
independence.
Yeah. But I know they probably makes them feel like I'm okay, and that makes them feel nice. So they do follow, and they don't really sort of call me or comment much, but once in a while, like if I'm sleeping and it's like early morning and my mom's seen like I'm in hypo, and so this has happened one or two times. She's called in to check, but mostly not much.
Oh, that's funny. Okay, so the other thing I want to touch on is you run marathons. You're one of those type ones that run marathons, which I love. I love that you're that physically active. So how did you shift into that? Because that's no small task.
Yep. So my dad's a runner. He and while we were growing up, the marathons were the runs were actually like a family picnic for us. So my dad would do the
Awesome.
26 miles. Mom and I have a younger sister. So the three of us, my mom, my sister, and me, we would do like the dream run. Like about 3-4 miles, whatever. And so that's how it started. And then I felt like, hey, if dad can do it, I can do it, right? So that's kind of how the bug came in, and I just kept at it, and I kind of like don't push myself too much, and I also have some injuries now, so I'm not actively running a lot. I'm just doing a little bit of strength training and some physiotherapy. But that's kind of where the running bug really bit me, thanks to my dad.
Well, I love that. I mean, and staying physically active, no matter what you're doing, is very important. And something else I'm curious about, and this is again going to make me sound, I hope to goodness gracious, not sound ignorant, but like I'm a big fan of Indian food and like to cook it myself. I'd like to believe it's good. But the carb ratios, because I count carbs when I give my injections, there's just so many other factors that go into that. So when you eat food outside of your traditional, and I say that loosely, culture, do you find it difficult to figure out the carbs?
Yes, it's definitely a challenge when you're kind of eating something out of the ordinary, something that you're not used to, and I mean we all know carb counting is such a lot of guesswork, right? Unless it's written on the back of the pack or something, it's kind of hard to figure out. So yes, I have been perplexed often. So last year I was in Europe, end of the year, and naturally the food is so different, right? It's a lot of meat and bread and potatoes and that kind of stuff. And also I do low carb since the last few years, so I eat a lot of meat and veggies anyway. So I was happy. I mean, I was like, okay, this is perfect. Uh, just don't give me the potatoes and I'll have the rest. So
I'm with you on that. Like I do low carb and have for ages, and I didn't even put it together with diabetes. It was more like I just was like, gosh, I don't feel good if I eat this.
yeah.
So I kind of like started to figure, oh wait, that because of the heavy carbs. Anywho, so it's nice to hear somebody else that is living a low carb diet, and that you're able to manage that in wherever you are. I think that's the biggest challenge for a lot of us because we get stuck in, and I don't know about you, but I get stuck in the same meals at home because I'm like, oh, well, I know that even though it could affect my blood sugar differently every single time,
Yeah.
I have a guesstimate as to what that carb count is going to be. Yeah. So I want to ask, okay, the last couple of questions, and I ask every guest this currently is, do you have access to fresh fruits and vegetables within a 2 mile radius?
Yes. I don't have any problem at all in accessing, healthy food. I know it comes from a place of privilege. I live in a big city. I've actually never lived in the countryside. I have like little to no idea about, I know it's tough. I interact with community members that live in far-flung places or live in, small towns or villages.
Yeah.
And it's a whole different sort of scenario there. But I am grateful and lucky to have access to pretty much everything I need.
Well, and that says a lot coming from a big city because there are so many food deserts, even here in the United States. A lot, and we're just now scratching the surface as to what that looks like and how do we find better options for people in general, not just people with diabetes, because we know that that's going to help with their management. The other question that I have for you is, obviously you got good education when you were diagnosed because you were in the hospital for quite some time and your parents helped with that whole transition. But do you feel like you've been given adequate educational materials with living with diabetes over the past, 20 years that you've had it? And that's, I don't know if I asked that question. I mean, like when you go to the doctor, they're like, oh, here's the newest developments. Have you thought about this? Or yeah, tell me about your continuing education with this disease.
Yeah, so I know this to be true for a lot of people, and I've actually had my best learnings through the online, the online diabetes community.
Yes,
It's just incredible. I mean, I would have never known about low carb, in all of these years, and India has such a carb heavy sort of way of eating. It's like 70-80% carbs. That's not for the blood sugars, and I just feel like I'm so grateful and lucky for friends online that I've never met and I'll probably never meet, unless we're in each other's countries. But I think I've had the best I mean, I'm in a big city. I have access to, fairly decent doctors, but I don't think they really know what it is like, right? Like no doctor in my 27 years of T1 has ever told me that, there's a thing called basal testing and that you must do it. And I mean, to be fair, I haven't seen a doctor in like the last 6 or 8 years, maybe. I'm doing fairly decently. My last A1C was about 5.6. I'm a low carb. There was this time I was trying to break the sixth barrier, a few years ago, and I told a doctor that, I'm so frustrated. I'm doing everything right. I'm dosing right. I'm eating low carb, and I'm just not able to make it. I'll be happy with a 5.9 also. Like I just want to
Yeah.
break the six thing. And he tells me that, you're crazy. This is, you should be happy that you have a
Yeah.
six, because most of my patients have 9 or 8 or whatever, and this is rubbish. I mean, you'll be okay. You'll be fine. And that's when I realized that, they're not gonna get it like the way we get it.
Yeah. Yeah. And I've never been offered an insulin pump, or it's never been recommended, because my A1C was always below 6.5. My management was fine. And it's crazy to me. But it's also, I'm glad that he, or that person, I don't know if it was a he, but it kind of made you take it down a notch, that, hey, your A1C is great. You know what I mean? Because we hear all these negative stories about, you should do better, shame, shame, shame. So it's kind of like, hey, give yourself a break. You're doing a really good job. So it's like a kudos, bittersweet. I don't know. But, and I want to end with the fact that you mentioned, as we started this conversation before recording, that, and I understand the burden at some capacity, is that people contact me daily, hourly, about somebody who's newly diagnosed, or I need this, or I can't get this, or I'm rationing insulin. And you said that someone had contacted you about it, somebody newly diagnosed. Do you want to share a little bit about that?
Yeah, thanks. So, a friend of mine, she's a T1. She was wanting to connect me with a family, a 14-year-old girl that was newly diagnosed. They were in the hospital, and she said to me that, I'm going to share her mom's number with you, and you could kind of get her added to the community. But maybe they should get out of the hospital first, and when they're a little sort of comfortable mentally, that's when I'll connect you guys. I said, okay, cool. And this was maybe 2-3 days ago. And this evening, I get a call from my friend saying, you know what, the child passed away. And I was like, what? I mean, this is just unbelievable. We're living in 2022. Back in the 90s when I was diagnosed, I get it. Like, if a lot of people don't know about T1 or whatever, I mean, I understand. But it's just not, this is not acceptable. Like, how can this be okay? And this is why I feel like the efforts that we're putting in need to be like, so like it needs to be multiplied. People know about the different types of diabetes. And I mean, it's so challenging because a lot of people here in India also try out alternative therapies. Some want to try yoga, some want to they actually stop insulin and try all of these other things. So it's really, really dangerous, and there's huge need for a kind of awareness. And what we part of what we do is go to schools, like public schools, private schools, corporates, and we conduct these kind of awareness camps and free blood sugar screenings. So I think that, I don't know, we just need to do a lot more to be able to reach out to doctors, to children, to families,
and make sure that people understand the severity of the situation, and that we need to catch it early on. I couldn't agree more. And one of my advocacy efforts is, any child, I mean, you go for your wellness checkups, hopefully every time their blood sugar should be checked. I mean, or if you go to the ER, I don't care how old you are, have your blood sugar checked, because that can say so much, or prevent somebody from something terrible. So I want to thank you, A, for being a guest, but B, for all of your advocacy work and the Blue Circle Diabetes Foundation. I would like a copy of the poster that's behind you, because I can't stop looking at it. I need that in my office.
Sure, yeah.
I'll be sure that in the show notes there are links to everything that we've discussed. Is there anything else you want to say to the listeners about whatever you want to talk about?
I think there's one last thing I want to say. So a lot of people ask me, why are you a community for people with all types of diabetes? Because T1 by itself, I mean, there's such a strong advocacy around T1 in particular. And I think that unless you acknowledge and talk about the other types of diabetes, no one's going to know about T1 in particular. People don't get it, like the general public, and that's why, and that's worked out for us, and hopefully for the people that are associated with us as well, because I see a lot of chatter on our channels about how T2s are learning from T1s and vice versa, and I think it's amazing because
Yeah.
over the years I've seen a lot of sort of fighting between the types of diabetes, like the T1s telling the T2s that you deserve this, you've got this.
Yeah.
I mean, come on, man, we're all in the same boat, more or less.
Yeah, I totally agree. And I changed my tune a few years ago because I used to bash the type 2 community because I was like, you had a choice. That's not how it
Yeah.
works. And we know that now. And that's unfair. So I applaud your efforts too. Of all people living with diabetes need the best care, and they need people that are compassionate and want to help. I mean, that's what we're all here for, is to help each other. So Nupur, thank you so much. And I will definitely stay in touch and be following what you are doing on the other side of the world with the Blue Circle Diabetes Foundation. I love learning about other cultures and how people in other countries manage their diabetes. I'm thrilled to now call Nupur my friend and hope to visit her in India one day soon. Before I wrap up, I have a few quick reminders. Number one, don't forget to visit my resources and affiliate page for killer discounts. If you'd like to join this list of reputable brands, just hit us up at Penelope at diabetesdailygrind.com for details. Number two, I know you're listening. Thank you. So be kind and throw a little change my way. Funds raised help keep the website, podcast, and advocacy efforts afloat. And finally, I'm here for my diabetes and the medical community, so feel free to contact me on any social media platform or directly at amber@diabetesdailygrind.com. Your continued support and love help keep the episodes coming. Cheers to the highs and lows, everyone.
The pricker is a pricker and the pumper is pumping beats like Wilford.